Welcome to Breathe California TV. Breathe California is the lung health organization for the state. 6 different chapters, and today I'm honored to have the retiring executive director of Breathe California of the Bay Area, Margot Sidener, with us. We're going to reminisce about a whole bunch of things important have happened, including Margot changing her name during that time frame. But you'll hear an awful lot of changes in smoking, and the level of air pollution has been reduced significantly. We'll talk about all of that in 30 seconds. See you then.
It's given me a chance to get out and be with people who has the same problem. And it helps you to manage your life better too, because you hear different things from each person, and it's just been really helpful in many ways.
Welcome back. My name is Terry Trumbull. I'm a volunteer for Breathe California. Each week we present a show for you to help you with your lung health. With most health related organizations, the vast majority of the money goes to helping people who've developed breathing difficulties in our case. But most of our shows focus on prevention, and I think you're going to hear in our discussions with Margot Sidener, the Breathe California Executive Director, that an awful lot has happened in that area in the last 34 years that she's been with the organization. So to show you the breadth of what they're doing, in this county alone last year, about 150,000 people with breathing difficulties were helped. So welcome here.
Thank you, Terry.
So Margot, we're going to try not to cry too much here. Margot is retiring after 27 years as executive director of Breathe California in the Bay Area, and 34 years with the organization, the last 33 on staff. And
I'm just going to be a volunteer, so we don't have to cry too much.
Well,
I'm not riding off into the sunset.
I am going to quite happily get Rex Nickerson, your successor on the show, as soon as possible to find out what he didn't tell you so that you could talk him into doing the job. But you've been quite spectacular during that time frame. And so there's so many ways we can go with this, but why don't you give us an overview? I met a woman named Margot Leathers in 1988 campaigning, and I put on a debate on Proposition 99, where you thoroughly stomped the tobacco industry representative who said it was a great, terrible idea to actually put a tax on cigarettes to tell people how bad the health consequences were. So start anywhere you want with your involvement. What got you involved with Breathe California?
I actually got involved because my son was diagnosed with asthma as a tiny baby. And when I had to rush him to the hospital, and he had to stay there for 8 days when he was only 2 months old, and should have just been being born because he was born 2 months early. That was a real wake-up call for me. And as a health educator, I had my master's in health education when I moved here to California, I decided I wanted to do something. I wanted to help other people so that people didn't have to go through that. And so I wrote a letter to, first of all, I got someone from our agency to come and speak to my sorority alumni group about this, because they were funding something that had to do with asthma. Ironically, all the things came together. And so I wrote a letter to our national philanthropy for Alpha Xi Delta, telling them what a great thing I thought this was and how it touched me. And then they sent it to the national organization with which we were affiliated before. And then they sent it back to the local, and then that person called and asked me to do some writing. So I started out doing writing, and then I redid the whole camp curricula, and then I ran the camp and so on, and then I was hired part-time and did all the jobs, and now I'm the person in charge.
Within 5 years, you were hired to be the executive director.
But then, yes,
Pretty
the acting.
significant.
Then I became the full.
You know, you can't take credit for some of this because Breathe California was originally the Tuberculosis Society. Is
Yes.
that the original name? Like in 1908 that this chapter started up?
1911, yes.
So why isn't it the Tuberculosis Society now?
Because people actually called on us to do a lot of other things. And as soon as, you know, TB was killing about 1 of every 7 people who died. It was responsible for that many deaths in this country and here at the time that we started as an organization. And with the advances that were made, including, of course, antibiotics, which were discovered, we pared that down. And so once we sort of had a handle on tuberculosis, which didn't really come until the 60s, then people started saying, well, you guys did such a great job mobilizing the community to fight this. You know, we need some help fighting COPD. We need some help fighting for better air quality. And so we just started evolving, and first we were the Santa Clara Tuberculosis Society, then we became the Santa Clara Tuberculosis and Health Association, and then later affiliated with the national organization, and then 9 years ago, can you believe it's that long, we became Breathe California and disaffiliated and went back to being just solely in Iran.
And so, you know, it's hard, I'm supposed to be asking you questions, but just to emphasize to our audience, about 1/3 of the people in the county, and same's true for any area with bad air quality, have breathing difficulties. It's not just TB. But just to wrap this up, somehow or other TB is back. What's
tuberculosis has always been an issue here in our community. When I started in the 1980s, we had had a sudden influx of people from many, many other countries where TB was just endemic. Everybody was exposed to TB. So because tuberculosis is such an odd disease and can be holed up in your body for years and then break out again, we developed a very, very serious problem here. So one of the first things that I did when I came was to try to gather materials that were in different languages so that we could use them with the new populations here. And then later, it wasn't going away. And so I think it was the year 1999 or something like that, I wrote a grant to try to get some help from United Way from their critical issues pot of funds. And we were awarded that and started with our partners, AKI, the Asian Americans for Community Involvement, the Tuberculosis Prevention Partnership. And that gets everyone together who cares about TB and does things like commemorate World TB Day, and it stays on top of all the things that are happening with tuberculosis control so that we can adequately serve all those populations that need to get our message.
So most people think in terms of lung disease, in terms of smoking. Since you started
Yes.
back in, what, 88?
82.
82.
I started.
You would think as a math major I'd do better with 34 years. What's happened to that? Because certainly I don't have a generalized perception of it being as scary
When
as it
I
was.
started, you could smoke anywhere. You could smoke at your desk at work. You could smoke in every public area. The only place you couldn't smoke was the movies, and that was because of fire. It had been declared a fire hazard, and you couldn't smoke there. But that needed to be radically changed. You could smoke as a kid on campus. They had areas where you could go smoke. The faculty could smoke in the school, inside. It was incredibly different than it is now. And we had very little in the way of services and programs that we could do for people who were smoking. So some of the first things I started with at our organization in the very early 80s had to do with both increasing the number of services for people who were smoking and also for protecting what we called non-smokers' rights. At the time, it wasn't called environmental tobacco smoke, it wasn't called secondhand smoke, it was called non-smokers' rights, because at the time we had no research to tell us really how harmful it was, but we knew it was very harmful. I have asthma, I cough when I'm around tobacco smoke. When you're coughing, you know that's bad. You know,
Yeah.
you don't really need someone to say how bad. You know it's bad, and you want to do something so that people aren't exposed to that. And so all by ourselves, our little agency took on getting ordinances passed. And we got probably the first ordinance in the country. I've never heard any different. In 1974, before I came there, they had the county ordinance passed in 76, which our friend Rod Diridon helped with that. And so by the time I came as a volunteer in 81 and and on staff as 82, there was a group within our organization that had been involved in a totally volunteer group called GASP, and they had come over to our organization and joined our environmental health committee, and were really pushing to do something about non-smokers' rights. So that's how
And
it
that
all
was
started.
my initial contact with the organization. I had a close friend named Kermit Smith.
Yes, Kermit.
And I think in 73 he got me to join GASP, and then later it merged with what's now Breathe California. Well, I just want to emphasize one of your points, because some people think that somehow or other they're interfering with people's liberty, but the controls that you're talking about are to protect innocent people from the
Yes,
damages.
exactly.
And secondhand smoke, if I can pick that one of the terms, has been proven to be pretty horrific. When we worked with
Yes.
San Jose Council 3 or 4 years ago to ban smoking in playgrounds and parks, I was astounded to hear that 60 feet away you could get cancer from secondhand smoke. You didn't have anything to do with it. You're walking in a park and it's...
If you were there over and over at 60
Sure,
feet.
yeah.
In other words, it's even has an impact outdoors. And so, but way back then, people didn't even think it had an impact indoors. And so we were working very hard for many years and virtually alone doing this. And then in the later 80s, our friends at American Cancer Society joined, and we had the group that is now Americans for Non-Smokers' Rights out of Berkeley that helped. And then we really got some steam and started going city to city to city to city, getting ordinances passed. But it was very difficult, and because, as you said, we didn't have the research back then, but we knew it was wrong. We knew that somebody needed to protect people from other people smoking. And so we were very, very successful. And then we would get one round passed, and then we would do another round and increase the restrictions. And that's the same thing we've done now for all these years until now we're working on outdoors and protecting people outdoors.
So we're talking with Margot Sidener, the CEO of Breathe California. It's amazing how your health has been protected from dangers of both tobacco smoke and air pollution over Margot's tenure. We're going to talk a little bit more about the changes and some things you can do to protect yourself. See you in 30 seconds.
Nice thing about Better Breathers Club is we go in and there's other people sitting around with oxygen. It's almost a relief that everybody looks the same in the room. It's a funny thing to say, but it's a good feeling. Breathe California means having resources available to us that will help guide us and make our lives easier.
Welcome back. My name is Terry Trumbull. I'm a volunteer. I chair the Preventative Health Committee of Breathe California. So most of our programs are either about smoking, but most of them about air pollution, which may even be a worse impact on your lungs these days than tobacco because of the success that Margot's had. But she told me if I don't talk about asthma and allergies, she's going to punch me out before the show's over. So you're on. How's
Okay.
our approach changed to those lung problems?
Well, I think the important thing to note is how the incidence of asthma has grown so tremendously, and we still have the asthma epidemic. 12% of all of our population has been actually diagnosed with asthma. That's in the county here, Santa Clara County.
And I have to interrupt you because one of the things that you worked on during your tenure is to get it classified as
Yes.
something that
So someone would follow it.
someone would follow it, and that's part of, if you don't identify it as disease, it's a little
You
hard.
don't know how many people have it.
Yeah.
Doesn't seem as serious, but for reasons that we still don't know exactly, the incidence has risen, and it's not going down. Even though we might have lots of prevention work that we've done in terms of having asthma-friendly environments, which is very important. It's still not really gone down. And so in some areas of our county, as many as 20% of children have asthma, and that's really not acceptable. But what's happened the last many years is that people have sort of forgotten about this asthma epidemic, and they've all moved over to fighting obesity. Almost all of the foundations, all of the big funders are now just fighting obesity. And we've lost out in terms of getting a handle on the asthma epidemic. So it's very important still. And so much has happened. When I came, there was little medication, and you really had every 4 hours to take that medication, and we didn't have spacers and peak flow meters and those things to help people judge how they're doing and to get the medication in better. If you needed a nebulizer, you had to go to the hospital. So it was a very different environment. It was very, very challenging for families, and that's why we started all the different family services that we have. And we still continue those because they're still needed. So anyone who has asthma or a child with asthma can call us and link in with all those supports, including free nebulizers. If someone is needy and doesn't have insurance coverage, we have that. And for COPD patients, we have other kinds of assistance, and even people who have sleep apnea can get a CPAP if they can't afford it. So we still continue all those services, and they're very necessary.
So one of the things that we have to do is bring you back in March just to explain all of those terms to us. But I think if anybody's unlucky enough to be afflicted with those
They know
lung
what a
problems,
CPAP is.
they know what it is. So one of the things that set me off in your comment is it's one thing to have a significant portion of our population affected, but to me it's doubly worse that it's the poor and the least
Yes.
able to cope with it.
And that's exactly who is the most affected. Our agency over the years has really evolved into one that mostly serves the lowest socioeconomic groups because they are the ones that are most vulnerable to all of this, including to air pollution. And they're the ones who live along the highways and get the bulk of the air pollution. And so we have definitely given most of our time to those populations.
So I want to encourage our audience to watch this show on Thursdays at 8 p.m. on Comcast Channel 15 this summer, because Chris Bacon, one of my colleagues at Santa Clara, has just published a study on environmental justice in this county that says all the things that you say. The east side of San Jose and anybody along freeways has far worse health effects than you will if you live in Saratoga or Los Altos Hills, principally from air pollution, but
Yes.
toxics in any form. So it's pretty significant. And I think you ought to brag a little bit because you're handling 400 health fairs a year to go talk to people and you're doing it in 27 different languages.
We do a tremendous amount of outreach because people need to know what resources are available. And we do have endless amounts of language capability because we have specifically gone out to find those resources. But that's what we need to serve our population because we live in the third most diverse county in the whole country. So it is a challenge. But we're doing most of our work in prevention, so hopefully that's really what makes the difference. And as a health educator, when I came here and I started working with the organization, that was naturally what kept me here because we're preventing those diseases and we're preventing death.
So let's give an example of that. This show will air roughly February 20th next, and you're going to the Tet Festival.
We
Talk
are.
just a little bit. I know it's not reminiscent, but it's a good example of what you're doing.
Well, actually, at the Tent Festival, we will be also selling beverages, so you can come get your coffee and cocoa and so on there. And that's sort of a draw to get people to come to our booth.
Yeah.
Not everyone might want to come and just hear about tuberculosis and asthma. So we'll be there. Our chair of the board this year, Min Duong, has arranged for us to have that capability at the festival. And we've been to the Tet Festival many times because that is an excellent place to reach our Vietnamese Americans. And so we'll be there again, and we hope everyone comes and buys a little something to help fund all of our good works here in the community.
So when I go to the Breathe California offices, there are 13 different lung diseases that we have brochures on, lung conditions maybe, and amazingly enough, almost all of them are in a great deal of different languages. So it is not like you're working really, really hard to serve the needs of venture capitalists in the North County.
Not really. But we would certainly like to have conversations with the venture capitalists in North County. So if you could set that up,
Well, I mean, that's kind of a dilemma that every nonprofit has, is how to generate revenue to do good deeds.
Right, because the people we serve and the people who are donors and other constituents have never been the same. They were a little bit more the same when I came here, but they've diverged more and more and more. And so it is a problem. We have to have a very diversified type of fundraising. And unfortunately, since the recession, we have depended so much on grant funding that has been shrinking. So we need resources, we need people, we need everyone to help out.
Well, grants obviously have a problem. They are wonderful and they're going to help that segment, but it means that the only thing you can do is meet the requirements of that contract with that group. And if you perceive that you've got a problem with the Filipino American community, you just don't have the resources, unless the public gives.
Right. So we need that undesignated money. We need people to send us $5 at a time in the mail, or stop and volunteer and help us to reach people. We need all types of resources. Give us paper, come mow our lawn. You know, all of these things are things that volunteers do.
So your retirement, I've been telling this true story that some people think's a joke. And
I am retiring. It's not a joke.
Yeah,
and
actually
I am of age to retire. Some people think I'm much younger, and then well, what else are you going to do? So.
Well, instead, my joke or anecdote relates to the reason you changed your name, which is your husband, Richie, you got married, what, 15 years ago?
16.
16.
But who's counting?
And he has been spectacular as a volunteer in raising money for you, meaning Breathe California, because he does all the maintenance and upkeep on the air conditioning, the heating, and virtually anything in the building. And I say raising money because you would have to pay that to somebody else.
He's a big in-kind source of money. Yeah.
And so
and he's volunteering also,
yeah.
but he's retiring.
But at the risk of having you kick me, some have said Richie's contributions, given
be
the
harder to replace.
price of those services, exactly. So I thought Richie deserved a
Thank
compliment
you.
here.
I'll
Nothing-
tell him to watch the show.
Yeah, that'll get us up to one person watching
Yeah,
the show.
yeah.
So what else do you want to talk about in terms of what you're doing? You're leaving behind a staff that I think is excellent, some
Excellent.
very good people.
We have cross-trained everyone. Some people have worked for me 4 different times on different projects. We certainly have the longest serving staff of nonprofits, I think, here. It ranges, I'm, of course, 33 years on staff, but even our fund developer has been there 17 years, which is a very unusual thing. And so we have people who know what they're doing, and I feel very confident that they'll do a great job and that Breathe California will prosper. And I've known for 2 years that I would be retiring. I know my birthday. So I've been planning this.
I was the board chair 10 years ago, and you told me you were going to retire in 2 years.
Yeah.
And
Well,
I kept doing everything I could to
my
throw
husband's a
him.
very patient man.
So I would urge any member of our audience to drive by her house, and if you see any indication of her retirement, get rid of it. I would appreciate it. So we got about a minute left. You've got 4 or 5 sentences to summarize your great life the last 33 years.
Wow. Well, I just feel so blessed that I've had a job that I can use all my talents at, and I can really make a difference every day. I have been able to feel that, and I know not everyone here in the Valley has that. So even though it might not have been the most lucrative and high-paying job that I could get, and I know that for sure, it's been wonderful, and I hope everyone will continue to support Breathe California.
So you've been incredibly successful and an inspiration, and not the least of which is the fact that you've retained staff so long. When being a nonprofit is tough for employees, you really got to get psychic benefits. So we've been talking with Margot Sidener, the retiring executive director of Breathe California, and I hope all of you are applauding in your homes for her 33 years of great work making you healthier. See you again next week with another show.
Thanks, Terry.